is Montshire Pediatrics Dentistry. We love this place. The reason why I love this place is because they taught me a lot about nutrition and how to prevent cavities when I first brought Margaret here when she was in her first appointment. And that made me really happy because as a kid I didn't know anything about that.
How's it going in here, guys?
I had cavity after cavity growing up and I hated the dentist. But coming here, she had that education, I had the education, and that set us up for, you know, success with teeth and then not hating your dentist and stuff. So can you tell me about your success?
Prevention is the key, right? Anything that we can do basically to make it so we can prevent cavities from happening to begin with, and ultimately if they are occurring, easy ways, comfortable ways to actually stop that process upstream. So the traditional approach is more of a surgical, where you're either drilling and filling the cavitation that's occurred, which is more symptom based. A lot of what we do, we still do surgical dentistry when needed, but if we can use a medical approach, it's much less invasive and we're actually able to treat the disease process. So one example of an active ingredient we use is silver. And so that's just a natural antimicrobial medicine that you scrub on the teeth and it kills the bacteria that causes the cavities. So we always say carbohydrates that you put in your mouth get metabolized by bacteria to create an acid. And so we're trying to mitigate that cascade. And so, like Dr. Johnny talked about with nutrition, being cognizant of the frequency and the duration of carbohydrate consumption is going to mitigate that acid production throughout the day. In terms of the bacterial load, we talked about using medicine that we can paint on the teeth to kill that bacteria. The other one is, brushing and flossing is a mechanical way to remove that bacterial load. And then that acid that gets produced, if we can buffer that back to neutral, so drinking water after snack and meal time is super helpful. So we try to treat that disease process, we say kind of upstream, in minimally invasive, more comfortable ways that don't require, the drill and fill. Try to avoid in that surgical procedures to focus on prevention and keep kids healthy. So that's like in a nutshell kind of what we're really trying to do. A lot of things that can be done at home to make that a lot better. It's not like everything that we need to do here. So by educating and talking to parents like yourself and teaching them giving them these tools, that's what really ultimately helps to create a healthy lifestyle to avoid lots of problems down the road. So yeah, that's kind of it in a nutshell.
Is there anything that you recommend at home for Margaret that we don't do? I'm not sure, besides brushing and flossing.
Just in general, brushing, flossing, water after snack and mealtime, trying to make sure that snack time doesn't go for long periods of time. For some children, we recommend using over-the-counter antiseptic, just betadine, povidone iodine. That's just an over-the-counter antiseptic that kills bacteria that causes cavities, so it helps with arrest and also prevention of future cavities. So use a drop or two on a Q-tip and you can apply that to the teeth. I use it on my own teeth for prevention, and it also helps with periodontal issues or gum problems. And so that's something over the counter that we recommend a lot for different folks just for prevention.